Mr. Jones, so I brought you into my office. I just want to talk to you about your progress and just how it's going in therapy. I noticed about 3 months ago you were just starting to decline, just in walking and your ADLs as well. Um, Even back then, like your wife told me, like she noticed as well that you were just like slacking off. So I don't know. And then of course today you didn't want to do the exercises, so you just weren't like really enthusiastic. Like I just tell me like what's going on. Like if there,
I just don't feel like my old self anymore. Um, I'm no longer the provider of my family. This stroke is, it's getting to me. It's getting to my head. I really don't care much about anything anymore.
and why is that?
I don't know. I just feel like it's stopping me from doing all the things I used to be able to do, and I just wanna. I feel like giving up.
What were some of the things that you used to do that you think you may want to get back to doing again?
Just getting back to work. Being able to put bread on the table. That's really what I really want to get back to. Just who I was before this stroke, and that's all. That's my number one, you know, thing I want to strive for is getting back to work. Cause
Do you, so do you think that do you think you're do you think it's possible for you to get back there?
I don't know. From what I hear about stroke, it's my outcome doesn't look too promising as far as getting back to who I was. But I guess that's why I'm here to begin with.
Do you think that um, do you feel that physical therapy is important in helping you getting back to what you want to do?
I mean, that's what they tell me. It's just that I guess since I don't see the results as fast as I want as I want to see them, I don't feel like I'm getting everything I need to get out of it. I don't really know how long it's gonna take, but
Well, I mean, I definitely understand what you're saying. We all want fast results. That's why we have fast food. That's why we have fast speed internet. But with stroke is different. Stroke, it takes time. Um, so it's a process, and with the process, it's important that we retrain the brain so that we can help facilitate recovery as fast as possible. But even, and I say as fast as possible, but again, it takes time. And
mm-hmm.
by time, I mean 6 months up to a year. And even in that, it's not guaranteed that you're going to fully recover. So for me, I'm really concerned because you haven't, you started off, doing pretty well in therapy, and then I just saw a decline. And so just from talking to you, like it really started to feel like you were depressed. Now,
Mm-hmm.
would you say that you've been feeling depressed and down and out lately?
Uh, I mean, I guess I haven't been doing my exercises like I should have been, and I just have a lack of motivation. I don't know if that means I'm depressed or not, but I just don't feel like doing anything anymore.
Well, I know that you did see the psychiatrist and she
Mm-hmm.
did a screening on you, and she gave me the results. And based on her test results, she diagnosed you with severe depression.
Mm.
Um, Now, I know it may sound like, oh, severe depression, yes, and she's giving you some antidepressant medicine to
Mm-hmm.
help with that. But depression is something that's associated with stroke. It's really common. So I just want you to let you know that you're not alone. Stroke can be a depressing, condition. Um, but I just really want you to really feel motivated to really get back to what you're doing, to participate in therapy. Like the little activities, they may seem little, but they're important in getting you back to doing the things that we do. And so one of the things I want to work on is, balance. And today, I know you didn't want to do the balloon toss, but that was working on balance. And balance is important for walking.
Right.
And with walking, then you'll be able to, move around the house and, maybe do some other things that you like to do. So that's what I want to work on in therapy. Is this something you feel that you can do?
Yeah, I mean, with the right guidance, anything to help me get back to work, help me get back to my old self, I'm willing to do.
Yeah, you kept mentioning this guy, Jim Bodine, who's a stroke survivor. Now, I knew Jim Bodine when he first had a stroke, and he wasn't walking.
Really?
He wasn't, and it took a lot of time. I think he was in therapy for about 7 months, and it just took that time over repeatedly doing exercises, and again retraining the brain to get him to the point where he's at now, where he's walking, where he can come to different clinics and talk to patients. Now, is that something you would like for me to arrange for you to have, Jim Bodine or maybe another stroke survivor come in and talk to you?
Yeah, I think that'd be a good idea to get some advice from someone who's actually been through what I'm going through, and, just to hear their story. I could probably learn a lot from them, because I don't feel like such a survivor right now.
Yeah, well, you are a survivor. You're alive. And I know you mentioned that the roles have changed in your family, but you'll always be a husband to your wife. You're still her husband. She may be your primary caretaker for the time being, but you'll always be her husband. But I really think it's important that you really participate in therapy, and that we work on, that we take steps toward your goals, which is getting back to what you want to do. Just to kind of review what we talked about. So I noticed that you haven't been participating in therapy, and you mentioned to me that you've been feeling down and out, and just haven't felt motivated to do anything. And you feel that with the stroke, like it's hard, and you're kind of expecting things to progress quicker than they are, and they aren't. And again, as I mentioned, stroke is a process. It takes time. And so it's really understanding the process of stroke and understanding that it's going to be a process. It's not going to happen overnight, and that we have to be patient and be willing to work through that process. Now, do you feel that you can be committed to therapy and working towards that goal of as much independence as possible?
Yeah, I can, but whether I could do it by myself or not, I'm not too sure.
Well, do you have any family? I know your son drops you off every now and then. Your wife comes by.
Yeah, just my wife and my son. My son lives about 30 minutes away, but it would be nice to have his support as well as my wife.
Well, definitely, I'll probably give them a call or email them and just ask them to come in as well, so we can just go over with them as well what we've talked about, and try to come up, get their idea and come up with a plan for how we can really work towards your goal and really try to get you more involved in physical therapy.
Right.
So does that sound like something?
Sounds like a good idea.
Okay. But I need your full commitment to this plan, okay?
Yes, sir.
All right. So you ready to go back out there and do some more exercises?
Yeah, let's do it.
All right.
All right.
Thanks.
He's in my right hand.